I know on behalf of all of the members of Independent Sage, we're absolutely gobsmacked by the amount of support that you and many others give us. And I also think it's a really exciting time for those of us committed to a zero COVID, a food suppression approach, because at the end of last week, we were part of the foundation of a World Health Network, which is fantastic news, bringing together people with similar views from right across the world. And so the movement is indeed building, and perhaps never has it been needed more, because we are in yet another phase. The thought suddenly occurred to me today that we're now in the grip of the third variant we've had, the third substantial variant we've had, and we're acting as if there is no possibility of there being another variant along, which is worse. Now, you would think after three emerging and causing us enormous difficulty, that it might be wise to prepare for maybe a fourth that would cause us even more difficulty. That would be the logical thing to do. I, as a kind of public health doctor, would think that way. And I should add that I forgot a brief biographical note. I'm from County Antrim in Northern Ireland, and I've did medicine, and then did trained to general practice, and then went into public health, and I was a regional director of public health for the southwest of England in the NHS and the Department of Health for most of my career, until I resigned in 2012 because of what was happening to the NHS under the Lansley Act. But we're in this extraordinary phase. I've just finished I just went up online today, a piece for the New Statesman, which starts, I had to reread this and reread this. And are you absolutely sure of what you're saying, Gabriel? I was saying to myself, I know of no episode in history where a government has willingly aided and abetted the spread of a dangerous infectious disease among its own population. And I really don't, and I pay a lot of attention to the history of public health, and I've never seen anything like this. There have been governments that have used biological warfare, or armies that have used it, but never on your own people. The people are meant to be on your own side. And we are in this incredible situation, I think. And it's very difficult to explain it to people abroad who just cannot understand that the government's policy is they want to have cases now. They want people to get sick now, and they want people to go to hospital now, and they want them to die now, instead of doing all those things in the autumn, because they think the NHS would be in even bigger difficulties in the autumn. That might well be so. And if the NHS is in difficulties, we should remember why. It's because it's exhausted as a result of bad management of the pandemic so far. It's understaffed because of the successive reductions in real terms funding that have taken place since 2010. It is overstretched. It was overstretched before the pandemic began, and it's got very little more to give. But at the same time, what the people in the NHS are there for, and what I, as a public health doctor, am concerned about, I've spent all my life trying to prevent people becoming ill, trying to help those who were ill avoid the consequences of whatever illness it was, hoping to avoid death and prevent death and delay death. And I'm astounded to hear a chief medical officer of the country standing up and saying that he wants to go, he thinks it's a good idea to go now. I don't think he quite meant die now, but he meant go in terms of relaxing all the restrictions and have this wave of infection sweeping over us now. So I find it an almost impossible to understand this situation we are in, but in it we are. And already we are seeing the result of it. Today's data: 96 deaths, much higher, far higher than any. And this is one of the other things. I've started comparing this July with last July, and amazingly, after a whole year of effort, and the government's efforts and the development of vaccines and everything, we're actually in a worse position in terms of cases and deaths than we were this month last year. It's an incredible situation, a bad situation, I think, a real failure. And And they have adopted this idea that clearly that we're going to have to live with COVID. And that was the title I was invited to speak to. And I don't believe it is possible to live with COVID. In fact, I'm sure it might be possible if you're prepared to live with long COVID and you're prepared to live with death and flare-ups and outbreaks. But we don't talk about living with any other disease as if that's the way forward. No one said that we had to live with HIV. No one said we had to live with variant CJD. No one said we had to live with tuberculosis or measles or any other dangerous infectious disease. What we do is we use all the tools that we have at our disposal as a society to try and prevent those diseases, to suppress those diseases, and to make sure people don't get those diseases. And that is not what we are doing. So it is extraordinary. And the fact that deaths have gone up 61% in the last week, admissions have gone up 38% in the last week, and cases have gone up 41% in the last week. And we are on this upward trajectory, and we don't know how long it'll last, but there is plenty of opportunity. One of the things the government doesn't say in the midst of constantly talking about how effective vaccines have been is that they are really effective at stopping people dying from COVID-19 and going into intensive care. But there are 2 points about it. First of all, they're not that effective at stopping infection, and people do get reinfected even after 2 COVID jabs. And you possibly already know someone that's happened to. I did. Anthony Costello, who's one of my fellow Independent SAGE members, about 4 weeks ago, got infected with COVID-19, having had his 2 vaccines sometime previously. And he's still not over it. He lost his sense of smell, and he talks very openly. He lost his sense of smell, lost his sense of taste. So he had central nervous system involvement, and still has fatigue. And it is nonsense to say that vaccines are going to solve all our problems. And that has been one of the things about the government's performance. I think they have always talked up the silver bullet. There was always something that was going. If you remember their enthusiasm about the app, their enthusiasm about lateral flow tests, their enthusiasm about antibody tests, they're extraordinarily enthusiastic. Their enthusiasm about NHS Test and Trace, one of the most expensive pocket lining exercises and useless pocket lining exercises any government's ever undertaken, probably in world history. Extraordinary. And it is just such a nonsense. And the nonsense is perpetrated, I think, or perpetuated and repeated because the government has been locked into this notion that the medical industrial complex, as we should rightly think of it, is going to solve our problems for us. They're going to solve, and this was Chris Whitty's line in particular, the science will ride over the hill to rescue us. And I always thought that was a very vacuous approach. Vaccination has come, and it has been a fantastic success so far as it's gone, but we know the problems. And the problems are multiple. Firstly, it doesn't do everything at all. It's a great help. Secondly, we don't have an even distribution of vaccination. The characteristics of most vaccination programs is that it's easy to get the first 70 or 80% of your target population, but you really have to work to get to into the 80s and into the 90s. And that takes long, arduous work by local people, by local primary care teams, local public health teams. That hasn't been happening, and we're seeing a variation in the uptake of vaccine. People who can't speak English have a very low uptake. People in some ethnic minority groups have a very low uptake. People who are in private rented accommodation have the lowest uptake of the housing groups. There are a whole set of people who have never worked or are in long-term unemployment. So as the virus continues to spread, those will be the communities. Will be the communities that are already impoverished. And I need to point out one thing that isn't never pointed out. When we came into this pandemic, we came into it in the midst of a public health crisis. It wasn't talked about. But it was a public health crisis because our life expectancy, which had been rising steadily over the last century, from 2012 onwards, has stalled. That improvement in life expectancy stalled. And for some people, particularly women in the poorest communities in our land, their life expectancy has been falling. So vaccination rates were falling, screening rates were falling. We know the changes that happened to the NHS. We know the destruction of the public health system and various other systems, and the concentration on contracting and commissioning, not actually doing things, but placing contracts and commissioning other people to do some things. No management, no performance, handing things over, particularly to the private sector. So against all that background, we have this mantra of living with COVID. Our way out of COVID has to be maximum suppression of the numbers, like any other infectious disease would do. We're not good at doing that. The UK lost its measles elimination status in 2016 because the system was no longer able to do that for us because it had been impoverished. That was part of the sort of crisis that I was speaking about in terms of public health. But it can be done and it should be done. And we need a vaccines plus program. We need the vaccines, absolutely. And we need to make sure everyone can have the vaccine. And I'm very unhappy, and independent states are very unhappy with the government's decision not to extend vaccination to 12 to 17-year-olds. The vaccine has been approved by the Human Medicines Commission. It has been approved by the MRHA, both on safety grounds. But the Joint Committee on Vaccination and Immunisation decided only to make it available to young people in very narrow categories of vulnerability, despite the fact that the safety profile has been proven. There are 9 million young people have been vaccinated in the United States. I don't think they had a single death attributable to the vaccine. There is one side effect, which is dealable with, that it has been found in a very small number of people, but it's a very, very safe program. And the government completely ignores the whole problem of long COVID, which is an enormous burden on families and people everywhere. And in fact, one of their key advisors on this, you might have seen him, Robert Dingwall, he doesn't believe long COVID exists. He's a professor of sociology in Nottingham Trent, and he was on Newsnight last night. Do watch it if you get the chance, with a wonderful colleague from New Zealand, Michael Baker. And he was essentially saying that JCVI don't believe that long COVID exists. I'm astounded by this. But so we need a proper vaccination program that reaches all parts of our community and reaches all ages, as the safety profiles allow. But we also need lots of other things. We do need to do the preventive stuff. We need a working, find, test, trace, isolate support system. People are not being adequately supported to isolate. No wonder lots of people can't isolate. They really don't isolate because they can't isolate. Either they don't live in houses or accommodation that would allow them to isolate, or they need to go out to work and they have unsympathetic employers or employers that simply don't provide sick pay. We need safe conditions for workers, and I think our next speaker is going to address that. I'm particularly keen on the issue of ventilation. Workers have rights to be provided with fresh air when they're working in enclosed spaces. COVID-19 has changed the definition of fresh air. No one can say that there is any right to fresh air at the moment under our current situation, and we're not doing enough to improve ventilation in all our public buildings, including schools, colleges, retail, factories, etc., etc. And we also need to continue with some of our other habits, and one of them is wearing masks when appropriate. And one of the deficiencies of the government is they haven't got the message over properly that COVID-19 is spread by air. A lot of people still think it's all about coughing and sneezing and droplets, and that their cloth face coverings are effective. They aren't effective because anyone who wears glasses and wears cloth face coverings knows how ineffective face coverings are, because the air goes out round them and up over your glasses. We really do need to do what some other countries have done and have adopted proper face masks, FFP2 or FFP3 face masks, and those should be provided free in schools, in places of work, and proper masking as well. So there are a string of public health interventions, and the government is ignoring all of these. So I think the situation is very difficult and will be difficult for some time, but there is no way out of this loop now. If we get a variant now that can seriously beat the vaccine, we're back to Groundhog Day. And I am not sure what will happen then. I'm not sure, but and there is a really good risk. And my final word is that the government is playing roulette. They are betting that there won't be a variant, and they are betting that this will all go well. And they're betting with people's lives and livelihoods. And it's not something we do as a community. We protect everyone. And I have no time for the eugenicist view that it's all right. These people, they're just dying a bit earlier than they would otherwise. And you remember the words at the beginning of the pandemic where every death was, I'm waiting for it to come back now, every death was someone with underlying conditions, as if that was an excuse for them being allowed to die. You know, it's all right, don't worry, they had an underlying condition. So there you are. I don't think we're in a good place, but I'm in good heart. I hope you're in good heart, because we've got work to do. Thank you very much.